Okay, hello everyone. Am I audible, guys? Okay, we'll discuss. Am I audible? No. Please tell some tricks to get full marks. Yes, yes. Now, let's see here. We will start. Uh, let's see the pattern. Okay, so this is NEET PG. We are having this 2024 discussion. We have this. Let's see the pattern. What is for the past 3 years? If you see, this is the overall pattern, guys. The overall pattern. The past 3 years. Okay, this is NEET exam. We're not talking INICT. The NEET exam, if you see, okay, so it covers most of the topic from the book. We are asking for tricks. Very simple. It's most of the topics from book, and only that is part text. And the last 3 years, okay, we are talking about last 3 years. Last 3 years. So there is no question on biostatistics and screen. Last 3 years. That means that no complicated problems are asked. Concepts are asked, but no questions are there from biostatistics and screening. But we may expect questions here. Since long we don't have questions, and no more questions from nutrition and infections. We had more questions from infections and no problems and numericals. This is for the last 3 years. There is no problems for numericals. Okay, that means hi Ganesh. Okay, there is no problems for numericals asked in the last 3 years. It may change, but I'm just telling you what is there, because INICT is different, this one is different. Limited image based questions. Okay, I'm not saying much image based questions. Questions overlap with other subjects like microbiology. It overlaps with other subjects also. Okay, fine. Microbiology, pediatrics, OG, it overlaps, and most of the questions are from textbooks. Okay, and very rarely recent updates have been asked. Okay, that means that don't search for updates. Okay, we hardly have some 40 days for the exam. Okay, so we have June 23rd. Okay, hardly have 40 days for the exam. Don't search for new things. Don't search for new things. Whatever notes you are having, read it repeatedly, read and revise it. Okay, I feel that in last 3 years, okay, except 10% of questions, remaining all are answerable. Okay, so we get around 20 questions, or roughly we got around 20 questions, roughly out of 200. Okay, 20 questions roughly overlapping with other subjects. So in that, okay, 17 to 18 questions we can answer. Okay, so in every exam we had some 10% of questions or statistic questions are there. So you understand the exams. So that means, okay, and last year exam also, if you seen the previous papers properly, okay, you will answer almost 50% of questions easily. Now, so we will start with this context. Let us start here. Okay, fine. Last 3 years papers, predominantly last 3-4 years, we will see which are the following thermometers is used to measure the low air velocity rather than cooling power of air. Okay, what is the answer here, guys? What is the answer? The question is, okay, it measures low air velocity and cooling power of air. So what is the answer here? So answer is, anyone? Carter's thermometer. Excellent. Okay, the answer here is Carter's thermometer. We will have a, okay, roughly 2 hours discussion, guys. Okay, roughly 2 hours discussion we'll have. The answer is Carter's thermometer. Carter's thermometer measures two things. One, it measures cooling power of air, and it also measures low air velocity. The question says only air velocity. Okay, air velocity, that means it is anemometer. Okay, the question says only air velocity is anemometer, but the question says low air velocity. What is the use of globe thermometer? Globe thermometer means, yes, it measures mean radiant heat. It measures mean radiant heat. And we also have hygrometer is there. A hygrometer, psychrometer. A hygrometer and psychrometer both measures humidity. Both measures humidity, moisture in the air. Both measures humidity, moisture there. What is use of dial thermometer? Dial thermometer is usually kept in ILR and deep freezer. Okay, to know the temperature of the vaccine, temperature of the ILR and deep freezer. Okay, whether we are maintaining the temperature or not. Dial thermometer twice daily we will measure. Fine. Okay, we'll go to the next question. Next question. This much is enough here. Next question. There is an outbreak of buboes in the community. What is the vector responsible for this question? Let's answer it, guys. It's a straightforward question. You can answer very easily. They have given buboes. Okay, which condition causes buboes? Yes. Buboes is what? Buboes is plague. This indicates plague. What is the vector for plague? Plague is 𝐒𝐿𝐴. Okay, this is the vector. Who is the reservoir here? Reservoir for plague. Reservoir is, we have this wild rodent. Wild rodent is a reservoir. Okay, fine. What is bubonic plague? Is the most common type of plague. Most common type of plague. Okay, fine. Which is the most dangerous plague? Which is the dangerous type of plague? Dangerous one is, okay, we have this called as pneumonic plague. So we had one question on FMG exams. Okay, how long you have to do the quarantine? Suppose older times they used to quarantine. Okay, plague caused so many pandemics. Okay, especially in the Middle Ages. What is that? How much quarantine period for plague? Quarantine period at older times is 40 days, guys. 40 days. Recently, okay, last year somewhere in FMG exam this was asked. For plague, older times quarantine period was 40 years. 40 days actually, 40 days. What is this? Phlebotomus argentifis can transmit. Yes, phlebotomus can transmit. Okay, it can transmit phlebotomus. Kala azar. Okay, Kala azar it can transmit. What about this tick? What about this tick? What tick can transmit? Tick can transmit KFD, Caissenor-Forest disease, tularemia, okay, babesiosis. Okay, these are the various conditions it can transmit. Okay, KFD, tularemia, babesiosis. Okay, these are the various conditions it can transmit. These are the various conditions. Okay, fine. This is buboes, plague. These are some of the points we should know regarding plague. Lot of factual questions, lots of facts. Less concepts were there, but more facts were asked. This is NEET exam, guys. NEET exam. Female anopheles, what it transmits? This you should not forget. What is this? This transmits malaria. Malaria it can transmit. Okay, answer this one, guys. Next question. Okay. So, in a district of Kerala was affected by floods, government distributed doxycycline tablets for prophylaxis. Which other chemical will be distributed along with it? Okay, fine. What is the answer here? Okay, why do you say malathion? Okay, why do you say malathion here? Is there any reason? Fine. Now this is I feel the answer should be what? Okay, the flood affected area of Kerala. Flood means what? Okay, so following floods, what disease are common? Maybe let us assume disaster will be there. Let us assume what are common? AGE, acute gastroenteritis is most common. First, fine. And next, what else can happen? We can there may be leptospirosis. Okay, leptospirosis can happen. Okay, fine. Rickettsial infections can happen. Okay, vector-borne disease will take several vector-borne disease. Okay, vector-borne disease will take several months, guys. Several weeks actually. Several weeks. Okay, fine. The preferable answer. Okay, the preferable answer. Government is saying that distributed doxycycline. Doxycycline we can see. Okay, two ways also we can see. Doxycycline, doxycycline can be given in two conditions. Okay, one is that as a prophylaxis it can be given in one is that leptospirosis also it can be given. Okay, fine. And it can be given in malaria also. Okay, high risk areas for malaria it is given, high risk areas. Okay? Doxycycline can be given. Okay, some mass prophylaxis we need not to give. It can be given leptospirosis and malaria it can be given. But the question they said, since they asking flood is there, flood, I will say differently, doctor. Okay, so since they are giving flood, okay, preferably we should not give mass chemoprophylaxis. I would say that, okay, it may be for leptospirosis, I would go for rodenticide, maybe zinc phosphate. What is the mode of transmission? Mode of transmission is by rat urine. Okay, so we can go with either way we can go. Okay, leptospirosis, rat urine, contamination, especially floods were asked. Okay, fine. Malathion, malathion is what? Is a anti-adult measures. These are anti-adult measures. This one is anti-larval measures. Okay, Paris green is anti-larval measures. Okay, but you can go with malathion also, but I would say that I will go for zinc phosphate for this question. Okay, fine. Since they are given floods. Okay, fine. And they won't give malathion to houses. Zinc phosphate can be used as a rodenticide. It can be used. Okay, it can be used as a rodenticide. Next question, guys. This is a straightforward question. Yes. Okay, following admission of RTA case, there is a spillage of blood in hospital floor. Okay, which disinfectant will you use to clean the floor? Okay, this is a direct question. Blood spillage ka kya hai? What is this blood spillage? Yes, it is sodium hypochlorite. Okay, fine. So we use this chlorhexidine for surgical antiseptics. It is used. And formaldehyde is used for fumigation. A fumigation of rooms and other things it was used. Fumigation of rooms, blankets and other things was used. So am I clear? So this is which disinfectant will use to clean the floor. So the answer is sodium hypochlorite. For other conditions we can use this. Fumigation of rooms and blankets we can. Straightforward question. That comes in micro also. Answer this question. The air quality index for 4 consecutive days in Delhi was given. Okay, fine. They are asking what about the air quality index on November 23rd. Okay, so November 23rd they have given this carbon monoxide is given, NO2 is there, PM10, PM2.5 is particulate matter is there. Question is related with November 23rd. What is the answer? Answer kya isme? What is the answer here? Okay, air quality index of 407. Air quality index of 407. Okay, look here. Based on the classification, okay, we can see this way. If it is more than, okay, fine. PDF we will send. PDF we will send it, guys. PDF we will send. So 100 to 200 it's moderate. 201 to 300 is poor. 301 to 400 is very poor. The question says is 401 to 500, that is severe. This is air quality index. Okay, air quality index. Okay, fine. Yes, the answer here is severe, guys. Severe. Fine. Which is the best indicator? Okay, the question asked past, it was asked which is the best indicator. The best indicator is first is sulfur dioxide, guys. Best indicator is first is sulfur dioxide is the best indicator. If smoke is there, second comes. The third is suspended particles. Suspended particles. The best one is, okay, SO2, guys. SO2. Sulfur dioxide is the best one. Fine. Excellent. Next question. Yes. Answer this. So very straightforward question. Yes, you can answer it. An outbreak of acute encephalitis in the community and vaccination drive was launched. Which is true about the vaccine given here? Okay, fine. So the question talks about acute encephalitis. Okay, which one indicates acute encephalitis and what is the vaccine given? Okay, in our program, the acute encephalitis what we have is JE, guys, Japanese encephalitis. Okay, JE vaccine is a live vaccine and it is given subcutaneous. This is right. And what in the program, what is the strain we use for JE is SA 14-14-2. Which vaccine is given orally, guys? Which vaccine is given orally in our national immunization schedule? OPV and Rota given orally. Which vaccine is given subcutaneously? MR and JE. Okay, we give subcutaneously. Okay, intradermally, which one is given? BCG, IPV, all other vaccine. Orally, one more also we can add. Vitamin A we are providing. All other vaccine IM, guys. All other are IM. Okay, IM. So what are the live vaccines we have? Okay, OPV comes in live vaccines. Okay, which are the live vaccines here? So which are the live vaccines? OPV is a live vaccine, Rota is a live vaccine, MR is a live vaccine, JE is another live vaccine. Okay, live vaccine. Okay, BCG is again a live vaccine. BCG is again a live vaccine. IPV is what? IPV is a killed vaccine. IPV is a killed vaccine. The question is JE, guys. JE. So it is given live vaccine, subcutaneously given. When it is given? 9 months. Okay, again at 16 to 24 months. Again 16 and 24 months it is given. Okay, this is straightforward question. So straightforward question. Acute encephalitis, we give it in the program, guys. What is the answer for this question? Is evaluation, okay, based on treatment given to patient and their clinical management. For any activity, guys, for any activity we will have inputs will be there. Okay, input, process, output. Okay, fine. Suppose a hospital you are running. Okay, you should have input, process and output. So for example, you take it a hospital or any program. Okay, what are the inputs here? So we have this physical structure, building is there. Okay, manpower we have. Okay, so all other equipments, all other things. Okay, that comes in. Okay, comes in input. Okay, output is what? Okay, deaths and disease treated, cured. Okay, how many people was cured? Okay, all these things comes in output. Okay, fine. So this process includes what? Okay, process include, okay, how the treatment was done, how treatment was done, okay, how the management was done. Okay, so all these things comes in process. Now the question is what? The question is, it is related with evaluation based on treatment given to the patient and their clinical management. This comes in process. Okay, fine. Process. This comes in process. Deaths prevented, disease prevented. So all this comes in output. Fine. Input comes manpower, whatever the equipments you are given, other resources. Okay, whatever you have done, that comes in input. Fine. Next question, guys. Yes. A girl child was a recurrent yeast infection, respiratory virus since she was 3 months old. Which of the following vaccine is contraindicated considering her immune status? Okay, what is the answer here? Yes, try to answer it, guys. What is the answer here? Yes. Okay, fine. Let's see that. So they are saying that this child is having some form of immunocompromised. Okay, they are saying that child is having immunocompromised. Immunocompromised means, okay, all live vaccines contraindicated. All live vaccines contraindicated. Okay, so what is this live vaccine here? This IPV is a killed vaccine. DPT, DNT or toxide. Okay, and P is killed. Okay, this one is toxide. So the answer here is measles. Measles. Okay, in live, all live vaccines are contraindicated in immunocompromised. So live vaccines are also contraindicated in pregnancy. Okay, pregnancy except yellow fever. Okay, in our country this is not a problem. In our country, if you ask, okay, all live vaccines are contraindicated. Okay, fine. Okay, all live vaccines are contraindicated in pregnancy except yellow fever. Guys, yellow fever. Okay, fine. Now, what is the maximum age you can give BCG vaccine? There are certain vaccines not more than 1 year. Okay, what are the vaccines that we should not give more than 1 year? Not more than 1 year. So we have certain vaccines. Okay, not more than 1 year. What are the vaccines we should not give more than 1 year? Okay, BCG, IPV, Rota, hepatitis B, pentavalent, okay, pneumococcal. These are the vaccines you should not give more than 1 year of age. Okay, fine. Next is not more than 5 years. Okay, not more than 5 years. Which vaccine you should not give more than 5 years? Okay, we have this MR, okay, OPV, vitamin A. We are talking national immunization schedule. MR, OPV, vitamin A. Now tell me here which vaccine up to 7 years. Up to 7 years is DPT. Up to 15 years is can give JE, guys. Okay, up to 15 years. Up to 15 years we can give JE. So JE we can give till 15 years. Okay, so this one, okay, remaining DPT we can give till 5 years. Okay, so MR, OPV, vitamin A up to 5 years. Okay, DPT 7 years, 7 years, and the first 6 comes we can give it only for 1 year, guys. Okay, 1 year. Answer this condition, guys. Which of the following is a conditioning influence for malnutrition? In a country like us, in a country like, which is considered as a conditioning influence is mainly infectious diseases. Okay, others are, okay, maybe has an influence, okay, but as a conditioning influence, okay, we have this infectious disease. You see here, we have this all these infections, diarrhea, okay, malaria, TB, and infection and malnutrition forms a vicious cycle. What is vicious cycle? Infections leads to malnutrition, malnutrition leads to, okay, infection. Okay, so infection, inadequate dietary intake, okay, so immunocompromised, okay, malnutrition. The malnutrition means again poor intake, okay, and it leads to infection. So this forms a vicious cycle. For conditioning influences, okay, the most important one, there are others are there, but the most important one is infections, guys. Infection. Answer this question, guys. Answer this question. Which of the following is not a component of global hunger index? Global hunger index क्या? Which is not a component? Not a component. Make a guess. Guess. Yes. Global hunger index is made up of 3 things. Okay, one is, okay, these are past questions only. One is under 5 mortality. Okay, one is under 5 mortality rate. So it will come. Okay, fine. What else will be there? Percentage of undernourished population, percentage of undernourished children. So what will not come is that infant mortality rate will not come. IMR. IMR will be part of PQLI. Yeah, IMR will be part of PQLI, that is physical quality of life index. So this percentage of undernourished children, we will look for wasting and stunting. Okay, wasting and stunting. How India is performing here. Okay, how India is performing in this global hunger index. Okay, India is performing very badly. So India in 2023, These are directly, it's there from book. Okay, don't say that it's not there in book. It is there in PAR, the chapter of sociology. It is there. In India was ranked 111, guys. 111 the rank out of all the countries. So global hunger index. Okay, India is ranking. Okay, so not in a very good state. Okay, fine. 111. Fine. Shall I continue, guys? Are you guys able to follow me? Others can message. Are you guys able to follow me? Yes or no? Just put it there. It will help me to continue, guys. Shall I continue? Okay, fine. I assume. What about others? Drug of choice. Fine. What about others? Others. Fine. Okay, Mukesh. Fine. We'll answer this question, guys. A researcher wants to know whether there is an association of CRP values with the risk of MI. The study was divided into quintiles. Quintiles. Okay, fine. Quintile means 5. Okay, fine. So 5 equal parts. 5 equal parts. Which are the following statements between relationship between CRP and risk of MI? Question is, which are the following talks about relationship between CRP and MI? Okay, so they are giving this, what they are giving, relative risk they are giving, CRP values. Okay, what is the answer here, guys? What is the answer here? This is interpretation. So we have this relative risk. Relative risk. Okay, what is relative risk? Which study you will get? You will get in cohort study, guys. Get in cohort study. What is the interpretation of relative risk? Equal to 1 means no association. No association between the exposure and the outcome. More than 1 means positive association. Positive association matlab risk factor. Okay, fine. And this one less than 1. Less than 1 means negative association. Negative association means protective factor. Now read the question and tell me the answer, guys. Okay, read the question and tell me the answer. Which one? Yes, if you see here, as the CRP value increases, what is also increasing? Relative risk is also increasing. So as the CRP value increases, okay, that means it has positive association. This is positive association. If positive association means it is a risk factor. So what is the best possible answer here? The increase in CRP values increases the risk of MI. Okay, as the CRP value increases, we discuss key point here. The relative risk, we can find it in a cohort study. Equal to 1, no association between the exposure and the outcome. Okay, more than 1, positive association. That means risk factor. Less than 1, negative association. That means protective factor. Now if you see the CRP values are increasing, that means relative risk is also increasing. It is a positive association. In quintile 1, there is no that is also an option. That is a wrong statement here. That is also a right statement. Okay, that means what? In quintile 1, there is no association. Actually, this is also correct only. If you see here, in quintile 1, okay, the relative risk is 1. The relative risk is 1. That means there is no association. In quintile 1, there is no risk of MI. This statement is also actually right. This statement is actually right. We don't know. Maybe typographical error. Probably it should be quintile 2. Let's assume it's quintile 2. But quintile 1, there is no risk of MI. That statement is correct statement. Better possible answer. Better possible answer is this one, guys. Better possible answer. Actually, the fourth statement is also right. Let me change the statement. Quintile 2. Okay, quintile 2. Okay, fine. So quintile 1, because the relative risk is 1 actually. Relative risk is 1. So that means there is no risk of MI is there. That statement is also right. Next question, guys. A child presented with pharyngitis, throat swab was obtained and sent for culture. So the used swab should be discarded in which color bin? These are straightforward questions, guys. Come on. What is the answer here? Yes. So this is swab. Okay, swab comes in microbiological waste. Microbiological waste. Okay, what is the answer? Yellow, guys. Okay, yellow. Okay, exam blood bags. Okay, blood bags should be there. Anatomical waste. Okay, all should go to yellow color. Give me some exam for red color. Red color bins में क्या चलता है? Okay, red color bins, what will be there? Red color bins, you can go for rubber, tubes, plastics will be there. That means gloves will be there, catheters will be there, saline sets will be there, IV sets will be there. Okay. White, what will be there? Shops. Okay, blue is broken vials, ampules. Okay, we have this broken vials, ampules is there. Broken vials. Okay, recently asked on is a pacemaker, metallic body implants. Okay, pacemaker was asked. Okay, fine. So this, the answer for this question is yellow, guys. Yellow. Okay, fine. Yellow. Which of the following is SI unit for measurement of brightness of light from the point of? So this is there in the book, textbook of Park. So just remember this. So brightness, we are talking of brightness, that means it is candle. You can remember like this. Okay, candle. Okay, fine. Second, HIV, sir, HIV blood stained gloves. Okay, any gloves, it should go to red only, guys, because we are going to do disinfection. Okay, we are going to disinfection. After that only it will go for recycling. Whether it is HIV stained or not HIV stained, no problem. So gloves should go to red color bin because it will go for disinfection. Okay, then candela, brightness is candela. What about lumen? Lumen, remember that inner lumen. Okay, inner lumen. Okay, light flows through it. Inner lumen, light flows through it. Flow of light. Okay, flow of light. Okay, light flows through it. Okay, fine. Now light, okay, so it comes from there and it reaches the surface. So that, consider lux as the surface. Okay, fine. So lux. Okay, light reaching the surface. Reaching surface. Okay, from the surface it is re-emitting, that is Lambert. Okay, it is re-emitting. Light re-emitting. Okay, re-emitting from the surface. From surface. You can remember like this, guys. Okay, fine. So first is that first brightness of source, that is like a bulb. You see, that's a candle. Okay, fine. Okay, bright candle is bright. Okay, so light from there reaches to us through the lumen. Reaching the surface is skin. Okay, that you consider as a Lux soap, like that you remember. And re-emitting from surface is Lambert, guys. Lambert. Fine. Next, a pregnant woman whose niece lives with her in the same house contracted varicella. She tested negative for serum antibodies against varicella. What would this mean? Come on, guys, answer this. Okay, microbiology question. Yes. Fine. What is the answer here? Antibodies. Okay, if there is no antibodies means what? Okay, zoster we cannot say. Okay, fine. So she is susceptible for what? Chickenpox. She's susceptible. She's susceptible. No antibodies means she's not having any antibodies. That means she's not having infection in the past. Okay, that means what? She's susceptible. Okay, fine. Susceptible. Okay, fine. Because chickenpox, one attack will give you lifelong immunity. Lifelong immunity. Chickenpox, one attack will give you lifelong immunity. It's not there in the immunization schedule. Anyway, if you want to have a vaccine, yes, we have vaccine available. Okay, strain. Ideally, it is given between 12 to 18 months. Okay, following this vaccine, avoid salicylates. Okay, for 6 weeks. Otherwise, it can cause what? Avoid salicylates for 6 weeks. Okay, otherwise, it can cause Ray's syndrome. It can cause Ray's syndrome. So it can cause a Ray's syndrome. You can avoid salicylates for 6 weeks. So okay strain. Okay, there is no antibodies means the person is not having immunity. Okay, so either by natural infection or vaccine she is not having. That means she is susceptible to chickenpox. School health programs are managed by which group? Okay, school health program ideally is managed by, yes, what is the answer here? School health program, we have this, okay. So RBSK, it can come under this, yes. Rashtriya Bal Swasthya Karyakram, okay. So whose responsibility is this? They will look for 4 Ds under this RBSK: defects at birth, okay, deficiency disorders, okay, we have this developmental delay. District hospital cannot come, doctor. It's okay, it's very difficult. And fourth one is diseases. Okay, ideal one is PHC. So school health program is the responsibility of primary health center. Okay, ideally it should be done twice a year. Twice a year. Okay, twice a year we have to see. Okay, this school health program. Okay, school health checkup has to be done. School health checkup, predominantly this comes as school health checkup. Okay, fine. What is a healthy school environment says? Healthy school environment says maximum students, 40 students per class. Okay, 40 students per class. They should have a minus desk should be there. Okay, and one urinal for 60 students should be there. One urinal and one latrine should be there for 100 students. One latrine should be there for 100 students. 100 students. This is school health norms. Okay, school health norms. Next question. Answer this question. Nutrition, we had so many questions. I think this year also we had 2 questions last NEET exam. What is the answer here? Answer yes. A man from Chhattisgarh. The clue here, what is the clue here is they are talking about central India, guys. Okay, central India. They are talking about muscle weakness. Okay, Prashant. Okay, right answer. Okay, drug of choice, that is fine. Okay, yes, okay, muscle weakness, leg spasms. Okay, this is more of a neuroletharism. Okay, this is more of neuroletharism. This happens because of consumption of kesari dal. It contains a toxin called as BOA. What is BOA means? Okay, yes, neuroletharism, BOA, beta oxalyl aminoalanine. Okay, the people consume this dal, okay, over a period of time, okay, nerves will be affected, okay, especially poor people. That's the clue here. Okay, the main clue what I would say is that Chhattisgarh, beta oxalyl aminoalanine, central India, poor people. So what should be the answer? History of diet, guys. History of diet we should. Okay, fine. Again we will get this question. What is the answer for this? A 10-year-old child, which are the following vaccines given as part of the immunization schedule? So at 10 years, 16 years, we are going to provide TD, guys. Okay, fine. Okay, your score is 70% in university exam. Okay, congratulations. Congratulations. Nice to hear. Okay, nice to hear. Yes, what is this TD, guys? This is straightforward question, TD, as well as pregnancy TD. Pregnancy 2 doses, 16 to 20 weeks. Again, 20 to 24 weeks. Okay, 24 weeks. 2 doses, okay, because we don't give nowadays tetanus alone. Okay, fine, we give, okay, PD. Okay, fine, diphtheria. Okay, 10 years. Okay, straightforward question. 0.5 ml delta. Answer the next question, guys. The average life expectancy for a woman is 87 years. Due to recent advances in the testing for cervical cancer, there is increase in life expectancy by 15 years. The healthcare utility value is 0.8. Which of the following can be calculated from the parameters given? Which of the following can be calculated from the parameters given? What is your answer? Yes, the answer is QALY, guys. QALY. QALY. Now, QALY means quality adjusted life. It means number of years of life added by intervention. How many extra years? That is the question. Okay, because of advances in testing, this person was able to live 15 years extra. Okay, 15 years extra this person was able to live with the utility of 0.8. That means, okay, not full health, some, let us assume somewhat okay health. So that means 15 into whatever extra years the person was able to live, multiplied by healthcare utility value, and you will get 12. So QALY is 12. That means this person was able to, okay, QALY is 12. That means because of treatment, okay, so this 12 number of years has been added. Okay, this is QALY. What is HALE? HALE means health adjusted life expectancy. What is DFLE? DFLE means disability free life expectancy. Okay, DALY. The other one is DALY. DALY includes two things: years of life lost plus years of life lived with disability. Two things. Okay, years of life lost plus years of life lived with disability. So two things is there. Okay, that is DALY. DALY is two things. Okay, so years of life lost, it indicates what? It indicates disease burden. These are some of the areas constantly asked questions. Constantly asked questions. Okay, fine. Let us assume, okay, some questions are repeated. These concepts are repeated in the exam. It should be useful to you guys. The next question, guys. Okay, you answer it. It's a vague question, but we can answer, I think. You are working in a PHC situated in high seismic zone. That means more earthquake prone area. Which of the following will you do as part of preparedness for emergency? Okay, what will you do as a part of emergency? Okay, suppose you are the PHC medical officer. Okay, अब क्या कर सकता है? What can you do? Disaster preparedness by making sure all financial other resources are available. Okay, fine. Increase public awareness through campaigns and speakers. Okay, fine. That is also okay. And conduct a simulation for disaster and assess the response. Simulation try कर सकता है, ठीक है. Follow instructions given over phone or radio by higher officials. What is the best possible answer? Okay, so if you see from the textbook of Park, okay, I think, okay, so you'll get all we can do actually. Okay, fine. So it is mandatory, you should be ready for financial resources. Awareness, we have to do it. Okay, fine. Conduct simulation for disaster and see assess the response. Yes. Okay, so this statement is also given. Follow the instruction given over phone and radio by higher officials. Okay, fine. So this is also done. So the best possible answer is all, guys. Okay, best possible answer is all. Okay, fine. This is very vague, but I feel that it can be done. All can be done as a PHC medical officer. Okay, fine. What about triage, guys? What about triage? Classifying injured people based on chance of survival. Red means what? The person is high priority. We are talking about triage. Okay, triage. Red means high priority. Yellow means medium priority. Okay, green means ambulatory. Okay, and black means dead. Okay, where it should be done, guys? Triage, where it should be done? Classifying the injured people, where it should be done? Site of disaster, or it should be done in the hospital, guys? Okay, where it should be done? Site of disaster, or it should be done in the hospitals? Okay, where it should be done? Yes, it should be done in the site of disaster. It should be done in the site of disaster. Site of disaster. Okay, fine. Again, this question without knowledge we can answer. Although many animals have implicated in the spread of rabies, dogs are the common ones. Also, it usually affects children in developing countries. Knowing this, what is the most cost effective and logical way to reduce the incidence of rabies? Okay, what is the most cost effective? Is testing all the dogs for rabies. Okay, I don't think it is cost effective. Increase the capacity of healthcare workers for surveillance is also not possible. Okay, increase laboratory facilities, that is also not possible. Okay, this is the best option. The best option. Reduce stray dog population, which government is doing, and vaccinate all individuals. What is the rabies free area? Rabies free area, no cases for 2 years. Okay, what are the rabies free area in India? Islands are rabies free. What are the rabies free area in India? Okay, Andaman, Nicobar, and Lakshadweep, guys. And Lakshadweep. These are rabies free area. Next question. Maximum, you can give immunoglobulins. Category 3 bites, you will give immunoglobulins. Immunoglobulin maximum, what age we can give? Maximum, how many days after the bite we should give? We should not give. Okay, so immunoglobulins we should be giving as early as possible, but not later than 7 days. 7 days. Okay, immunoglobulin we should not give after 7 days. 7 days we should not give. Next question. Okay, fine. Answer this. Answer this. Which are the following steps not included in the STEPS approach of WHO? STEPS approach is for what? This is for NCD risk factors survey. NCD risk factors survey. Okay, 3 steps. Okay, what are they? Step 1. Step 1 you will do questionnaire. Okay, smoke risk factor measurement. Questionnaire by risk factor. Okay, questionnaire for risk factor. Okay, you are going to ask, are you a smoker? Are you an alcoholic? You are going to ask. Step 2. What will you do in the step 2? Physical measurements. Okay, physical checkup you will be doing. Okay, BMI, BP. You will be doing BMI and BP and all. Step 3. Step 3 is what? What will you do in step 3 is that biochemical measurement. Okay, biochemical measurements like FBS, cholesterol we can do. Now what is the best possible answer here? Okay, best possible answer is what? Step 1, 2, 3. Okay, physical we can do, psychological, okay, and behavioral, okay, therapeutic assessment. Okay, the psychological behavioral can come in questionnaire, it can come, guys. Physical assessment can come. Okay, best possible answer is A, guys. A, therapeutic assessment. Okay, therapeutic assessment. Okay, this is smoking, alcohol, okay, all these things can come in. Okay, behavioral and psychological it can come. Physical assessment second is there, and therapeutic assessment we are not doing. Next, answer this next question. A male patient diagnosed with tuberculosis to complete treatment. The first examination, okay, was done. So at the end of IP, end of CP. So what is this one? So you are doing 2 sputum. Okay, so both are found to be negative, guys. Both are found to be negative. So end of IP is also negative. End of CP is also negative. 2 continuous sputum negative means it is cured, guys. What is the treatment we provide? We have this treatment. Category 1 only we are having 2-HRZE, HRZE, 4-HRE, 4-HRE. Okay, so this is follow-up is done at end of IP and end of CP. Even if end of IP the patient is positive, no problem, you shift the patient to continuation phase. Okay, fine. What is this drug monitoring concept is called as? Drug monitoring concept is, what is that? What we call it as? Okay, we have this 99 dots. 99 dots is there. The patient has to give a missed call from his registered mobile number. Okay, the drug strip will have the this toll-free numbers will be there. From the registered mobile number, the patient has to give a missed call. That means the patient has taken the drug. This concept is called as 99 dots. This is for treatment monitoring. Treatment monitoring. Fine. Next. Answer the next question. A cohort study was conducted with the drinkers and non-drinkers of green tea. Okay, and the risk ratio was found to be 0.84. Okay, which statement is correct? Okay, so this is exposed, non-exposed. The risk ratio is the other name for relative risk as 0.84. Okay, already we have seen. Okay, already we have seen equal to 1 means no association, more than 1 means positive association, less than 1 means negative association. Okay, that means both, whether it is a relative risk and odds ratio. Okay, both interpretation is same. Relative risk and odds ratio. Okay, दोनों interpretation same ही है. Okay, so green tea reduces the risk of diabetes. That means less than. Okay, both indicates what? Both indicates strength of association. Both indicate strength of association. Equal to 1, no association. More than 1, positive. Less than 1, negative association. Which statement, this is 2022 NEET question, which statements refers the best for criteria to start a CHC, urban CHC? Okay, what is the answer here, guys? What is the answer here? Urban CHC, the criteria is that, okay, normal areas 2.5 lakh population. 2.5 lakh population. Metro cities 5 lakhs. This is the basic criteria. Okay. Normal areas we should have 30 to 50 beds we should have. Metros we should have 100 beds we should have. 100 beds. And under every CHC there will be 4 to 5 PHCs will be there. 4 to 5 urban PHCs will be the urban PHC. So what is the answer here? So it caters, this is wrong, 2 to 3 PHCs, no sub-district, no 100 bedded facilities in metro cities. That is the right answer. Recently we also have this urban health and wellness center, sub-centers in urban areas. Okay, this we are talking in urban areas for 15,000 to 20,000 population. Okay, health and wellness sub-centers in urban areas for 15,000 to 20,000 population. So who will be there? There will be one doctor will be there. Okay, one doctor. Okay, doctor will be. This is health and wellness centers. Okay, sub-centers in urban area, and they wanted to create a polyclinics. For every 2.5 lakh population, they wanted to create polyclinics. They wanted to create polyclinics. Only OPDs by specialists. Polyclinics, only OPDs by specialists. This is urban, okay, health infrastructure. Guys. Urban health infrastructure. Next question. How is a broken vial disposed? According, yes, this you already we have discussed. Come on, answer it. Okay, so how is a broken vial is disposed? Okay, yes. Answer this. Broken vial. Okay, broken vial is disposed according to biomedical waste management. Okay, how is it disposed? It is, yes, white color, guys. This is puncture proof blue bin. Okay, fine. This is right answer. This is right. Puncture proof blue bin. This is right actually. White container is for what? This is for shops. This is for shops. Okay, white is for shops, that we know. Okay, what other things blue bin we will be adding? Blue bin, what we will be adding is Okay, we will be adding blue bin is that metallic body implants. Metallic body implants. Okay, blue we can add metallic body implants. Answer this. This is the question. How much money? Okay, the question is related for Asha. JSY, Janani Suraksha Yojana. In urban area of state of Madhya Pradesh, a primary gravida goes for institutional delivery after being motivated by a Asha worker. What are the benefits they will receive in terms of money in rupees under JSY, Janani Suraksha Yojana? Janani Suraksha Yojana. JSY. Okay, so the criteria is that so we have to see low performing states. Okay, low performing states. Okay, all women, all deliveries are eligible to get money. Guys. Madhya Pradesh comes in low performing states. Okay, so Bihar, Uttar Pradesh, okay, Rajasthan, Chhattisgarh, Jharkhand, okay, all these UP, all these comes in low performing states. Right. So what is the criteria? Look here. Okay, so we will take this one. Okay, rural areas, urban areas, okay, low performing states. HPS means high performing states. Okay, how much mother will get? How much Asha? Mother and Asha. Look here, low performing states, mother will get 1400, Asha will get 600. Okay, so in urban area, mother will get 1000, Asha will get 400. High performing states, 700, 600, 600 and 400. Okay, 700, 600, 600 and 400. This happens in high performing state. This happens in high performing state. Okay, now let's go there. Okay, Asha is not a fixed salary worker. What Asha will get is performance based incentive. Okay, performance. Okay, there is no fixed salary. Okay, she has to do certain tasks. The task is okay added with money. If she task complete कर रहे मतलब okay उनको पैसा मिलता है. Okay, fine. Now look here. What is the answer here? Madhya Pradesh is now answer guys. Madhya Pradesh and it is urban area. Now tell me the answer here. Madhya Pradesh and urban area. Answer it guys. What is the answer here? Okay. 1000 for the mother, 400 for Ash. Okay, urban area. The question is urban area, 1000 for the mother, 400 for Asha. They would have changed these values, okay, but these are the original values which is given in the textbook of PARK and that has been asked. Okay, this program JSY is launched in which year? 2005. 2005. Answer this one, guys. Next question. Which of the following agency provides seeds and manure for applied nutrition program? Yes. India was having applied nutrition program 60s and 70s. Okay, so it is UNICEF actually. They provided seeds and manure in applied nutrition programs, guys. Applied nutrition programs, seeds and manure, guys. Seeds and manure. Okay, and we have this WHO. Okay, so this year, what is the theme for this year, guys? What is the theme for World Health Day? 7th of April. What is the theme for this year? My health. Okay, my health, my right, guys. Okay, my health and my right. That is the theme for this year. Okay, theme for this year. My health and my right. Okay, fine. Next. And what other agency? Okay, we have this Ford is there. Okay, recently asked questions. The Ford Foundation, they contributed for development of construction of toilets in rural areas. Contributed for construction of toilets. Construction of toilets, rural India. Okay, these are the points we should know. These are the points we should know. Okay, 7th of April, my health, my right, guys. Toilets. Answer the next question. Many children from a particular community coming to hospital were detected to ALL. It was assumed it is due to presence of cytotoxic waste in the water of that community. If a case control study has to be done to find whether chemical and ALL are associated, what will be taken as controls? Okay, cases are children with ALL. Control. Who is a control? Okay, so what this is a case control study. Who is a case? Case means people with disease. Controls matlab people without disease. Okay, fine. Let's see one by one. Okay, basic understanding is that it's a case control study, means it's a retrospective study. It starts from outcome to exposure. Children from the area exposed but not affected by the disease. No. The basic criteria is cases means people with disease, controls means people without disease. Children in the area not exposed affected with the disease. No, this is also wrong. All children irrespective of exposure status. No, this is all children with ALL. This is also wrong. Okay, so what is the best possible answer? Children coming to OPD who do not have the disease. Children coming to OPD who do not have the disease. Okay, this is what the answer here is. Okay, that means people coming to OPD. Case controls mean people without disease. Cases means people with disease. Nothing related with exposure, guys. Exposure. What you can find is odds ratio. Next question. Answer. The AIIMS has to conduct vaccination camp in a village. She received 2 open vials. Okay, one is pentavalent, another one is MR. Under open vial policy, okay, so normally BCG, MR, JE would be used within 4 hours. BCG, MR and JE, they have to be used within 4 hours. So once you open it, you have to use it 4 hours. Okay, remaining all vaccines can be used. We are talking about the national immunization schedule. Remaining all vaccines can be used for 4 weeks. Now tell me answer K based on this. Okay, this concept is called as open vial policy. Come on, answer it. Which one we have to discard it, which one we can use it? Yes, what is the answer? Use pentavalent vaccine and discard MR vaccine. Okay, if you use MR vaccine more than 4 hours, okay, MR vaccine more than 4 hours, it causes a condition, guys. Okay, onsa condition. Come on, another half an hour. It's 7:30 or 7:45. I'll try to finish. Yes. Okay, MR vaccine. Okay, if used more than 4 hours, what it can cause? It can cause a condition called as TSS, toxic shock syndrome. MR vaccine used more than 4 hours, toxic shock syndrome. Okay. Yes. So we came to 2023 NEET question. In a varicella outbreak in a boys hostel, which of the following is correct regarding management of cases and control? Okay, fine. What is the best possible answer? As per statement from the book, directly varicella outbreak in a boys hostel, which of the following is correct regarding management of cases and controls? Yes. Okay, so the book says that isolation should be there. Okay, isolation should be there for 6 days. Okay, and susceptible contacts. Okay, quarantine for susceptible people. Okay, susceptible people. Quarantine can susceptible people. Okay, this has to be there within 72 hours. Susceptible people, like immunocompromised are there. Okay, susceptible people. So the best possible answer, what can be the best possible answer? Yes. Okay, so we don't have much option here. Isolate cases for 7 days. Immunoglobulins has to be given for 72 hours. Along with quarantine, these susceptible people, what you can give is that we can give immunoglobulins within 3 days. In 3 days. So quarantine susceptible people along with immunoglobulins. We can provide immunoglobulins. Immunoglobulin. Isolation is for 6 days. 6 days. Fine. Next. Come on, guys. Answer. Answer. Yes. More people are here. Okay. Answer it. Now, okay. So, which among the following is true regarding Colombo plan, guys? Which among the Colombo plan? Colombo plan is a meeting held between Commonwealth countries. Okay, this is for Commonwealth countries. Okay, so and we a very random question. Okay, it's very. This is what I said. No, the sadistic question will be asked, but it's there in textbook of Park. So one is the COBOL plan development along with establishment of AIIMS, guys. Okay, establishment of AIIMS. Okay, AIIMS was established. Very random question. AIIMS New Delhi was established with the help of New Zealand. Which country helped us to establish means it was New Zealand. AIIMS was established. AIIMS was established. Answer this next question. A female patient came to OPD with the complaints of vaginal discharge and cervical discharge. The husband was a truck driver. What would be the kit? Okay, we are going to follow this syndromic approach. Syndromic approach. Okay, and the clinic has been renamed as Suraksha Clinic. STD clinic has been renamed as Suraksha Clinic. Okay, so we have this fine. So we have this vaginal discharge. Okay, let's go with. Okay, so first one is urethral discharge. Urethral discharge is there. Okay, urethral discharge. Anorectal discharge. For this one, it is gray color. Gray color. Vaginitis. Vaginitis. This is green color kit. Green color kit. So genital ulcer disease. 2D. White color kit. Okay, white color kit. White color kit. So and we have this painful GUD. GUD means genital ulcer. Painful. A painful GUD. Painful GUD means we have this red color kit. Lower abdominal pain, we have this yellow color kit. And buboes are there. If you have buboes, inguinal buboes, buboes means we have this black color kit. So now tell me what is the best possible answer. Okay, vaginal discharge is there. The better answer will be green color kit. Okay, green color. Okay, so this is green color kit. Okay, fine. Now, so this is syndromic approach. Okay, this is syndromic approach. Okay, and we are using the clinic has been renamed as Suraksha Clinic. Suraksha Clinic. Fine, fine. Excellent, excellent, guys. Fine. Again, this last exam question. A poor farmer with a successive crop failure has progressive neurological failure. They given the clue: poor farmer, successive crop failure, progressive neurological failure. What is this condition, guys? Okay, we have discussed this. This is more likely to be a neuroletharism, and because of BOA, beta oxalyl aminoalanine. Beta oxalyl aminoalanine. Okay, sanguinarine can cause what? Sanguinarine is causes epidemic dropsy. Sanguinarine causes epidemic dropsy, guys. Sanguinarine causes epidemic dropsy. And what about fluorosis? Okay, normal RDA is 0.5 to 0.8 milligram per liter of water. More than 1.5 milligram of water, it can cause dental fluorosis. Okay, so more than 1.5 milligram per liter, it can cause dental fluorosis. It can cause dental fluorosis, and dental fluorosis it can cause. Okay, these are the points. These are the points. Okay, aflatoxins can cause what? Aflatoxicosis. Okay, aflatoxicosis. Usually they will infest groundnuts. They will infest groundnuts. They will infest aflatoxins. Groundnuts. We have this endemic ascites is there. Endemic ascites. This is caused by pyrrolizidine alkaloids. Pyrrolizidine endemic ascites. This is caused by this pyrrolizidine alkaloids. Endemic ascites. Endemic ascites. Which of the following is the correct way to collect water samples? More micro question. Okay, anyway we can also do it. So whenever the water is that running tap, okay, so what you have to do is that, so answer is D, guys. Okay, answer is D. So if the tap is in regular use, you open the tap, let it flow for 2 minutes. Okay, then after that you collect it using a sterile container. You take a sterile container. Okay, you collect it. If the tap is not in regular use, okay, what you have to do is that you have to flame it. This nostril is there. This is the nostril is there. You just flame it. This area you have to flame it for 2 minutes. Okay, after that you open the tap, let the water flows for 2 minutes, then you collect the water. Okay? So the answer here is collect the running tap after 2 minutes. Okay, after 2 minutes we have to collect it. Answer is D. This is a very regular question. Answer this. Okay, a child, okay, 6-year-old child presented with fever, rash, coryza, complex spots. What is the answer, guys? Yes. So the answer here is, this is a feel good question. Their exam, measles. Okay, measles, complex spot. That is a pathognomonic feature. Now tell me here, when the complex spots will be seen. You tell me. Okay, it is seen in opposite to, okay, opposite to first or second lower molar tooth. Now tell me when it will be seen. When it will be seen. Before the rash, after the rash. You will get maculopapular rash, you will get. Okay, it will be seen 1 to 2 days before rash. It will be seen 1 to 2 days before rash. What about rubella, guys? Okay, congenital rubella syndrome. What are the parameters it will be there? Okay, one is PDA, cataract. Excellent, guys. Okay, excellent. You're answering very nicely, guys. Fine. Now, cataract, PDA. Okay. Third one is sensory neural hearing loss. Sensory neural hearing loss. Okay, fine. PDA, cataract, and sensory neural hearing loss. Okay, fine. Again, same question was asked. We already discussed. What is this question? A 10-year-old child came to OPD for vaccination. As per national immunization schedule, what needs to be given? What needs to be given? Yes, the answer is yes, yes. TD. TD is given. It's a straightforward question. So, what is the diluent that we are using? For BCG, what is the diluent? BCG, we are using normal saline. And for measles, MR vaccine, it is distilled water. Tell me some AEFIs of DPT. DPT's AEFIs is persistent inconsolable screaming. Inconsolable screaming. The first one. Second one I will write here. Second one is AEFIs. We are talking about AEFIs. Hypotonic hyporesponsive episode. Hypotonic hyporesponsive episodes. MR vaccine can produce thrombocytopenia. MR vaccine can produce thrombocytopenia. AEFIs, we are talking about AEFIs. Persistent inconsolable screaming following DPT. Okay, inconsolable screaming. So DPT can produce hypotonic hyporesponsive episodes. MR can produce thrombocytopenia. Just giving some points, guys. Okay, you can quickly go through. Answer this question. Yes. A pregnant female presented to OPD with headache and no visual abnormalities. The blood pressure was normal. The patient did not eat papaya and other foods since they can cause abortion. Which health worker will be assigned for regular home visits for pregnant females for the purpose of nutrition education? Can you answer it, guys? So all of you say Asha. Yes, not Asha. Yes, this is nutrition education is the job of Anganwadi worker, guys. The job of Anganwadi. Anganwadi will be there for every 400 to 800 population. It will be there. Okay, 400 to 800 population will be there. So what's her job is that she will be doing providing supplementary nutrition. Supplementary nutrition for children and pregnant mothers. She will be doing growth monitoring. Okay, growth monitoring. Will be involved in immunization. And immunization usually happens in village in Anganwadi, and she has to provide nutritional education. Nutritional education. Nutritional education. Am I clear? So these are the points, guys. These are the points we should know, guys. These are the points we should. A person comes to clean cut wound with a history of vaccination 10 years back. Okay, what is the appropriate management for this patient? Appropriate management. Patient is having a wound. Okay, fine. So you are going to ask the history of wound. Okay, so let's see here. So clean wounds, unclean wounds, unclean. So less than 5 years vaccination has been done. Last 5 years nothing is required, guys. Nothing is required. 5 to 10 years, one dose. Again, one dose is required. More than 10 years, one dose. Here also one dose plus immunoglobulin. Right, now let's see last 5 years. Let's see to the question. Okay, if the person comes with a clean wound, the clean wounds. So 10 years back, that means the patient is what? More than 10 years in wounds. The answer is what? Single dose, guys. Single dose. So unimmunized only we have to go for complete course. If the unclean wounds, we have to go for immunoglobulins. Okay. Otherwise, it's single dose, guys. Single dose is fine. Yes. Okay, it's a straightforward question, guys. Okay, answer this. Workers using heavy machinery. Okay, heavy machinery shows intermittent symptoms of white fingers. Okay, yes. What is this? So this drilling and all, people use the drilling. Okay, people use drilling. This vasoconstriction will happen. Yes, this is answer is what? This is vibration. This is vibration. Okay, vibration. This vasoconstriction will happen. White fingers. White fingers you can see. Okay, people working in drilling, other areas you can see. And we had one more question is there that was not added here. Cement workers. Cement workers, they got exposed asbestosis. A condition, cement workers, it is common. Okay, so it affects the lower part of lungs. Pleural plaques are common. Okay, common is pleural plaques are common, and we have, it can go to what? Mesothelioma. Okay. So you're asking what is type 1 error and type 2 error. Okay, at the end of last question, you remind me, guys. We'll discuss. Okay, fine. But what is type 1 error, type 2? In the end we will discuss. Fine. Now, this is mesothelioma. This was also a question. This was also a last exam question. Which of the following will be depicted as years of life lost? Years of life lost, we discussed previously. DALI, guys. Okay, DALI. DALI is what? Years of life lost plus years of life lived with disability. Right. So what is this years of life lost indicates? Years of life lost indicates premature death. Okay, premature death. Okay, fine. Look, for example, the person, this is at birth, the person is supposed to live 70 years. Okay, and he develops stroke at 60 years. 60 years he develops stroke. At 65 years he died. Now tell me how many years is the he has lost. Stroke at 60 years, he was not able to walk for 5 years. 5 years he was not able to walk, and 5 years he lost. So here is 5 years with disability life lost plus 5 years he lived with disability. So DALI is 10. DALI is 10. How much is the DALI? So 5 years, okay, stroke, 5 years he lived with disability, and 5 years he has lost actually. So that is DALI is 10, guys, 10. Okay, fine. So what is the answer here? Answer is years of life lost due to premature death. Okay, premature death. Okay, fine. This is DALI. DALI, it indicates disease burden, guys. Disease burden. Which of the following vitamins can be used in the prophylaxis of neuroletharism? It comes in 5 stages, guys. Okay, latent stage, no stick stage, 1 stick stage, 2 stick stage, crawling. Okay, crawling. You can go for crawling. And so what are the ways to prevent? One is banning the crop. Just ban it. Okay, one is banning the crop. Second, what you can do is that vitamin C prophylaxis. Answer is this one, guys. Third one is what you can do is that removal of toxin can be done. Removal of toxin. Okay, removal of toxin by methods called as parboiling and steeping method. These are the methods we can do. Parboiling and steeping method, we can do removal of toxin. Toxin can be done. These are the methods we can do. Okay, for prophylaxis of neuroletharism. Okay, fine. Which of the following is the best indicator for the health care of the community? Best indicator. So, which one will give you the best indicator of health status of the community? So, health status of the community is given by infant mortality rate. Infant mortality rate. Now, tell me what will perinatal mortality rate will give you what? Perinatal mortality rate give you what? No. Human development index is not the best indicator. It's a composite indicator, guys. So, human development index will tell you the quality of life. Okay, approximately it will give you quality of life. It is made up of life expectancy at birth, per capita income, and knowledge. Perinatal mortality indicator gives pregnancy wastage. Okay, it's an indicator for pregnancy wastage. Under 5 mortality rate indicates what? Under 5 mortality rate is an indicator for social development and well-being. Social development and well-being. Under 5 mortality rate indicates social development and well-being. Perinatal mortality rate indicates pregnancy wastage. Human development index is quality of life. Quality of directly it will tell you the quality of life, made up of 3 parameters, and infant mortality rate is the best indicator for the health status of the community. Health status. Answer this question. Nice question. Aniline factory information was taken from documents for 2 groups working in a factory. Okay, look here. First is what is case control study. Case control study, it starts from, what is case control study? It starts from outcome to exposure. It's case control study, right? Outcome to exposure. Cohort study. Cohort study starts from exposure to outcome. Am I clear? Outcome to exposure is case control study. Cohort study is that exposure to outcome. So this is again prospective cohort study. Prospective cohort study. So prospective cohort study, let's say that I am doing a study in 2024, starting from exposure to outcome 2034. So this is, okay, we are starting this study in 2024. I am following people, okay, from 2024 to 2034. Okay, fine. This is a prospective cohort study. Now, what is the retrospective cohort study? Any cohort study starts from exposure to outcome. I am doing this study in 2024. I go back in time. I identify a cohort. What is a cohort means what? Cohort means group of people with common characteristics. Let's take a cohort of 2010 cohort. Okay, I divide people into exposed and non-exposed. In 2024, I will check the outcome. This we call it as a retrospective cohort study. I will repeat again. Okay, case control study, just straightforward outcome to exposure. Prospective cohort study starts from exposure to outcome. From today onwards, you are following people. Retrospective cohort study, you go back in time. Okay, even if you go back in time, you are going to start from exposure to outcome. That is the difference between a case control study and a retrospective cohort study. Okay, retrospective study also go back in time, but it goes from outcome to exposure. Okay, so but case control study, so it goes from outcome to exposure. Retrospective cohort study, even if you go back in time, it starts from exposure to outcome. So what is the answer here? You got this? Got this? Retrospective cohort study, even we are going back in time, starts from exposure to outcome. Okay, now read the question. Aniline factory information was taken. The question has given the clue of documents is there. Okay, the question says documents. Okay, they are taking information from the documents regarding exposure, non-exposed. I'm currently checking the answer. So the best possible is retrospective cohort study. Go back in time, divide people into exposed and non-exposed, check their outcome status now. A patient who was suspected to have TB has sputum negative but X-rays are positive for TB. The next line of management for this patient too. Okay, what is this? AKI. Okay, that means both sputum are negative, guys. Okay, sputum are negative. Two actually, sputum and chest X-ray will do. Okay, both are negative, guys. Okay, even if one positive means it's TB. Okay, both are negative, but X-ray looks positive. Okay, this is the situation what they are asking. Both sputum are negative, X-ray looks positive. If it is there, then we have to go for a test called as CB-NAT. We have to go. We have to go for a test called as CB-NAT, confirmatory test. We have to go for CB-NAT. Okay, if CB-NAT is positive, it's TB, guys. CB-NAT is positive for TB. What is the investigation for drug-resistant TB? Is culture and DST, drug sensitivity testing. Okay, drug sensitivity testing. So for drug-resistant TB. Okay, fine. What is this one? A person with low blood pressure tends to have low blood pressure in adults. This concept is called as tracking. You just plot a graph, time and BP. Okay, those children having low BP, in adult also they will have low BP. Those children having high BP, adult also they will have high BP. This concept, okay, this concept is called as tracking. Okay, so if you identify these children, we can start preventive measures. Okay, preventive measures. Okay, which condition? Hypertension is associated. Again, rule of halves is also associated with hypertension. What is rule of halves? Okay. Out of the estimated cases, okay, only 50% of cases will know that they are having hypertension. Among them 50% will be on treatment. Among them 50% will be adequately treated. So suppose 100 cases are there, means 50% they will know they are having hypertension. Among them 50% will be on treatment. Among them 50% will be on adequate treatment. Okay, fine. This concept is called as rule of halves. You will see in hypertension. Tracking also you will see in hypertension. Few years back we had a question. Monica is related with what? Okay, Monica is a study that we did it for CHD, coronary heart disease. 3-4 years back, it's a NEET question. It's Monica study, guys. Okay, it's a CHD study, coronary heart disease study. Monica. Chronic alcoholic patients came with the OPD with the double vision. Okay, involuntary eye movements, mental confusion. What is this one, guys? Is this one, you can answer it. Niacin causes pellagra. Okay, so you will get, what are the D's you will get? Diarrhea, dementia, dermatitis and death. That is niacin. Riboflavin causes angular stomatitis. Vitamin B12. What does vitamin B12 will cause? Vitamin B12 will cause pernicious anemia. Thiamine can cause two things. One is beriberi. The second one is causes chronic alcoholic. What is common? Wernicke's encephalopathy. Wernicke's encephalopathy. The Wernicke's encephalopathy. So you can see in hospitals, chronic alcoholics, they will come with these symptoms. Okay, double vision, chronic alcoholics. Okay, so they need thiamine infusion. We will put thiamine infusion. We will put. This is thiamine, guys. Wernicke's encephalopathy. The recommended daily allowance. The recommended daily allowance for fulfill the needs of what percentage of population? Okay, this is the last question. So the recommended daily allowance, okay, RDA should fulfill 97.5% of population. So usually for all nutrients, okay, whenever we are calculating recommended daily allowance, RDA is based on mean plus 2 standard deviation. थोड़ा extra value देते, okay, for all nutrients, mean plus 2 standard, थोड़ा extra value. But for energy we use only mean value, no added value. For energy we use only mean value. For energy we use only mean, no need for extra, otherwise it get deposited as fat. So for other things we use only mean only we use. Fine. You are asking a question, right? What is type 1 error? What is type 2 error? You are asking. Yes. Fine. What is type 1 error? First, let us assume a statement called as what is null hypothesis. Null hypothesis is an assumption. You are making an assumption, guys. Assumption. Both groups are same. Suppose I have two groups are there. I have two drugs. Okay. Suppose two groups are there. Group A, group B. I divided group A, group B. For group A, I am giving new drug. For group B, I am giving old drug. I want to see whether drug A is better than drug B. For this purpose, okay, for this purpose, I can have to go for test of significance. So what is the assumption I am making is both the groups are same. Group A, group B, dono same. The assumption I am making. That means what I am saying is drug A equal to drug B. Okay, now, so after this, what you will do is that you will do statistical test dete. So after that, you will get p value. If p value is less than 0.05 means you are going to reject null hypothesis. Now, what is type 1 error? Matlab kya? Type 1 error is, okay, now tell me, is rejecting null hypothesis okay, when it is true. When it is, okay, what do you mean by that? Null hypothesis true means what? Both the groups are same, but you are concluding one group is better than the other group. First, second, read the second. Null hypothesis true means what? Both the groups are same. Drug A is equal to drug B, but you are concluding one drug is better than the other drug. This is type 1 error. The next one is type 2 error, exact opposite. Yes, exact opposite. Okay, what is this? Accepting null hypothesis when it is false. Accepting null hypothesis when it is false. मतलब क्या है? Null hypothesis false. Both the drugs are not same, but you are concluding both the drugs are same. That is type 2 error. Remember one, that is fine. Okay, usually type 1 error is as null hypothesis true, but rejecting it means both the groups are same. There is no difference between the two drugs, but you are concluding both the drugs are different. Okay. So hope this clarifies, and we will post this PDF of this lecture on the Telegram channel. Okay, we'll put it there in the Telegram channel. Okay, so you can kindly find this. Okay, so thanks for listening. I already told you. Okay, NEET exam very straightforward. Most of the questions come from the book. Okay, you can answer it. Okay, so all the best, guys. Okay, if you have any queries, otherwise, thank you, guys. Okay, fine. Thank you, guys. Thank you. Okay, so all the best. All the best. Okay, so you should come out of your exams with flying colors. Okay, fine. Thank you. Thank you. Any queries? Thank you, guys. Thank you. Any other queries?